Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Weening.
And I'm Dr. Paul Zalzal.
Today, Paul, we are doing a video on a question that is very common in the comments on our channel, as well as pervasive in the news over the last kind of 5 to 10 years. Will I get addicted to narcotics?
I'm out of here.
It's tricky.
You can't do a video on that on YouTube.
It's a tricky topic. It's a tricky, because obviously there's not a straightforward answer.
That's a tough one.
And I think the short answer is unfortunately you might, which is the truthful, honest, no baloney answer. Mm-hmm. But there are a lot of things that you can do as a patient, that we can do as physicians to help mitigate some of that risk.
See, well, the problem is because almost every time you have a total knee replacement or a total hip replacement or a total shoulder replacement or some sort of major orthopedic surgery, after the surgery you get a prescription for narcotics for a period of time.
Especially in Canada, and I know a lot of the viewers in the United States, I think the laws are slightly stricter there. Mm-hmm. So patients have mentioned that they're frustrated, that they're in agony, and their doc's not answering their calls, and they're not getting repeat prescriptions. So that is intended for your benefit. However, here we kind of do it in a little different way. We prescribe it in a different way. So how do we do it?
Well, we have sort of a routine protocol for pain control, and and it's sort of age dependent a little bit, but the hallmark of it is it's a multimodal approach to pain management. So what do we mean by multimodal?
Okay, so I mean
lots,
modes, types of treatment.
Yeah.
Types of treatment. So we do a whole bunch of things. So not just medication, so a whole bunch of medications, even different classes of medication, but also other things like whether that's splinting or ice or elevation or compression with a stocking of some sort, plus medication. So I guess the first answer is not everything requires narcotics, but some things definitely might.
Major orthopedic surgery, I think the majority of the time you require narcotics as part of your multimodal approach, and in addition to those non-pharmacologic options, we also give you different types of medication.
So let's focus on that part.
An anti-inflammatory, acetaminophen, some sort of nerve agent or nerve, something to control nerve pain, and some form of narcotic, be it short-acting or long-acting.
So wait, so you can take all those pills together?
Check out our other video.
There is a good video.
Acetaminophen and anti-inflammatory, but yes, you can take them not forever, but for the short period of time. That's the other key thing about narcotics after major orthopedic surgery. It is to manage a pain that is temporary, and that it will go away as time progresses away from that surgery. The farther you are away from that surgery, the pain gets better and better and better, and so the narcotics are for a short period of time.
And for a specific reason, because you had an operation. Because sometimes I'll see patients who either want narcotics, like before surgery, because they say my arthritis is really bad, and I'm like, yeah, you need a total knee replacement. Can I get some Tylenol 3s or some Percocet or whatever? I'm like, I don't think so, because there's good evidence to show it doesn't help, and you just get more and more used to them, or potentially addicted to them. So that's the first thing. And the second thing, sometimes I see people who have been getting it from another source, and then it's like it doesn't really work anyway, because it's not designed to help arthritis. It's good for post-operative surgical pain.
And guess what? You probably got narcotics during the surgery.
Yes.
The anesthetist or anesthesiologist will have given you some, because that's part of an anesthesia. Major part of anesthesia is pain control.
Okay, so in Canada, after your total knee, do we give you like 100 pills and like 10 repeats?
No, that's it. I don't even know if you can give repeats on
You
it.
cannot.
You can't give
Fun fact, in Canada you cannot write repeats. So a lot of people say, can you give me a couple repeats? And you're like, no, because the pharmacist will not fill it. So there's a law designed to protect over-prescribing of narcotics.
Yeah, a repeat is an automatic thing on your prescription that lets you go back to the pharmacist without seeing your physician to get more of whatever it was. So narcotics can't get repeats.
So why don't we do repeats? Why was that implemented?
Because we know it's a temporary pain that you're having after surgery. We know it should be going away. So we know that you should only need the narcotics for a temporary time. And if you're still having a ton of pain after your narcotics have run out, maybe there's something wrong.
I want to see you.
Come and see us. Come and see the surgeon so they can make sure everything's healing appropriately. And because we don't want people to get addicted. We don't want people just to, hey, I'm going to keep getting my repeats, keep getting my repeats. Addiction.
And I tell people too, because people are like, well, how many should I have this week and this week? And I say, well, it's different for everybody, because some patients will be like, oh, I didn't even need my whole prescription, and other people, as soon as it's out, they want another one. So everyone's different, everyone's surgery different, so don't feel bad or feel guilty if you do require more. I'd say in general, you just want to make sure that your narcotic consumption is going down steadily. So right, if you're taking 6 yesterday and then 2 weeks from then you're taking 7, that makes me nervous. I want you to take 6 and then 5 and then 4 or whatever. I want it to be going down. And sometimes it goes down slower for some people.
Right. And like you said, sometimes you don't finish your prescription. It's very important, if you don't finish your prescription, bring the pills back to the pharmacy so they can be dealt with appropriately.
So you can't just flush them down the toilet?
I wouldn't flush them down.
No, you can't. Because they said actually a lot of water sources, when they tested it, has like medication like that, has birth control, has all sorts of things, antibiotics. So yeah, definitely bring it back. And then the other reason is, unfortunately, if it's sitting on a shelf, someone may be tempted to try it or to take it. So yeah,
certainly,
get it in a safe place.
It's usually the teenage population is at risk for that kind of stuff. So
yes.
You asked the question at the beginning, will I get addicted to narcotics
yes.
after my surgery if I get them?
So I think the chance is actually very, very low, particularly if we have discussions like this. So we'll talk to the patient, say this is necessary, it's definitely short term, but it is, particularly for knee replacements, it is critical to your success, but that together we'll have a plan to essentially get you off of them as quickly and safely as we can before you can get addicted.
Okay. Here's a pickle for you.
Okay.
I've had a history of addiction to narcotics, and now I want to have major orthopedic surgery where I know I'm going to need narcotics after. What do I do?
So that's complicated, to be very honest with you. And we've had this before, so then you discuss with the patient, some people's like, I'm not taking it. And I respect that, and then we say, okay, well, we're gonna have to use more acetaminophen or ibuprofen or the nerve agents or ice or whatever, and that it's gonna be difficult. And then maybe keep it in your back pocket just in case. But
and it requires you can, right? If you are willing to try it, you have to be closely observed. If you have a history of addiction to narcotics, just make sure you have a good relationship with your physician where there's going to be close observation. And then the number of pills you get will be limited, and you might have to go back to the pharmacy more frequently to get your total number of pills that you need, but it'll be limited so that someone's watching to make sure that you're not taking too much at once.
Because you don't want to have, hey, look at me, I didn't take any narcotics, and then now I have a knee that bends 20 degrees.
Yeah, because I didn't have any pain control during physiotherapy, so I couldn't bend my knee after total knee replacement. So it just needs to be very closely monitored if you have a history of addiction to narcotic. What if I'm taking a boatload of narcotic right up to the day of my surgery? What happens then?
So this happens, particularly people with chronic back pain. It seems that I'd say that's the person in my practice that has the most common non-surgical consumption of narcotics. So usually I would tell those people, listen, we're going to give you your baseline level, and we're going to give you more than that because it will require more after surgery because you have new pain or you have extra pain. And then the goal would be to get you back to your baseline, or hopefully sometimes even less than your baseline, depending on what you were taking it for before. It's not going to cure your back pain, but sometimes then you can have a strategy to get off of it.
And I often will try and encourage my patients to get off the narcotic before we do the surgery. Taper right off. Obviously it's not working, or you wouldn't be in my office asking for a joint replacement. If your narcotic pain control for your arthritis was working, why are you here, right? So taper off the narcotic first. We do the surgery, then we can give you a lower dose of narcotic and then get you off.
And I think it's critical, like, we're not trying to be insensitive to pain, or because a lot of people are like, oh yeah, it's easy for you to say I have really, really sore knees or back or whatever and I need my narcotics. We totally get that. But the bottom line is that it's not great for your problem, and I think there are better solutions. So we need to try to just kind of rejig it.
And we're going to say all this with the preface that we are not chronic pain doctors. We are surgeons.
And that's actually good.
Chronic pain doctors will use narcotics to manage chronic pain, and we're not stepping on their turf here. We're just saying what our observation is from in the surgical population.
And I think every now and then it is required in specific settings that are very unique to the individual, and that should be just managed carefully by someone just to try to reduce the risk of an addiction for sure.
So we don't mean to offend anyone who's on chronic narcotic use. We don't mean to offend any chronic pain physicians who use narcotics in their patients who manage chronic pain. Just in the surgical population, the question came up for us was, will I get addicted to narcotics? And our answer is, you might, but it's very, very unlikely for the reasons that we discussed.
And this purpose of this video is to let people know that it can be safe. It is a very effective medication to control pain when it's used properly. And I think that was the problem over the last 10 or 20 years. I think kind of things went a little sideways, and they were prescribed with less thought, not unintentionally most often. But now we're much more educated about the problems associated, so we prescribe it much more carefully.
So remember, now let us know what you think in the comments. But please Don't be offended. Don't be upset by anything we say.
Pain is a very personal thing and it's very real.
Yeah, and we are not downplaying anyone's pain or downplaying anyone's narcotic addiction, but we're just trying to tell you what our perspective is when we approach the use of narcotics after major orthopedic surgery.
Yes. So if you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health.
We'll see you next time.